Welcome to the first episode of Just Press Lay. And I'm super excited to be chatting with our guest today, Dan Miller, CEO and founder of Spora Health. Dan, welcome. Thanks for being our first guest.
Awesome. You're very, very welcome. Super excited to be here. Thank you for having me.
Of course. Maybe just to start, would love to just hear about your story, your journey. How did you come to found Spora Health? And tell us a little bit about Spora Health too.
Yeah, so Sport Health is a virtual primary care practice uniquely designed for communities of color. And we focus on creating what we call culture-centered experiences, in which we really take a population health specific approach towards everything we do, and the culture of these populations that we serve at everything we do. So that is reflected in the brand, that's reflected in what's included in the product experience, how we train our providers, but also how we approach every single interaction with our patients. And this journey for me started back in 2019. I was really thinking about my lived experience of my loved ones when I was looking for inspiration for the next company that I wanted to found. And I kept coming back to my experience with my great-grandmother when I was in middle school, in which my great-grandmother came to live with us up in New Jersey from rural North Carolina. She was suffering from dementia and late onset Alzheimer's, and was having a tough time being comfortable with the providers and the caretakers she had access to in New Jersey. And so my family, the elders in my family, decided that I would be her caretaker after middle school. But if I didn't have practice, I would come home. I would take care of grandma for a few hours until my aunt got home. And that was a really challenging, trying experience in my life, time of my life. And I presume the same for my great grandmother. And that was my real first exposure to these sort of inequities and folks not wanting to engage with the healthcare system because they didn't feel comfortable with the provider. But also my first exposure to families filling in the gap that healthcare systems were leaving voids for. And I was thinking about these stories and really wanted to focus on this problem. And the more that I researched and dug, the more that I learned that there's a lot of opportunity here, and very small changes in our approach can produce significantly better experiences for different populations.
Wow, that's super inspiring, Dan. Maybe to dive a little bit more into the details, because I would love to unpack that a little bit. And I'm caveat by saying this is a loaded question, but when you talk about those small changes, when you talk about those areas of opportunity, how do you think about making healthcare more equitable?
Yeah, I think a primary example that comes to mind is addressing maternal mortality and morbidity rates for Black women. This is a primary example in which small changes can produce significant outcomes and save lives. And so right now, today, 60% of maternal mortality and morbidity cases can be prevented. And they can be prevented through solutions that we can deploy remotely and virtually. And so access to doulas in some cases, OBs, in other cases, PAs and NPs, to support folks through their pregnancy and postpartum, are ways that we can deploy scalable solutions very, very quickly that can produce much better outcomes for underserved populations. In addition to that, also leveraging things like remote patient monitoring, so we can track vitals, can also help us get ahead of instances that will lead to mortality or morbidity, cases like gestational diabetes or preeclampsia, et cetera. But when we zoom out, we need to think holistically about what is equitable for the community that we're serving. And that's going to change. That's going to vary from different population to different population. But the more holistic that we take a view of designing an end-to-end experience, I think the closer we'll be to creating equitable systems, and then being able to really clearly understand where we need to iterate to continue to make those systems equitable.
Really interesting. So the examples you gave, like equitable from the perspective of access to not just experts across a variety of different services, but also to technology, as you were saying, and then zooming out. I'm just kind of playing this back, Dan. Zooming out, thinking about kind of population by population, making sure that those services and those technologies are equitable across all different populations. Am I kind of getting the gist of that right?
Absolutely, absolutely. And to the latter point, we take a culture-centered approach towards how we narrow the populations that we're serving, right? So we don't make assumptions that, as an example, all Black folks want the same sort of solutions or the same sort of experience. And we know, I know that. I've been a Black male for 37 years. I know that. But also we train our providers to understand that as well, and take a more curious approach towards understanding what makes sense for the individual in that moment in time. So specifically, what type of foods they like to eat, what their, the types of activities they like to engage in, what makes them feel good from a sort of emotional, but also a physical sort of wellness perspective as well. That helps us frame the conversation when we're designing treatment plans and how we engage with folks as well.
That's really interesting. So when you talk about culture-centered care, and you describe the approach you just gave, is it really down to the individual level, or is it a little bit broader than that? When you say kind of culture-centered care, what exactly does that entail for a provider who, works at Spora?
Absolutely. So it does start a bit broader than that. At a sort of population level, we've uncovered that we needed to address a real gap in skills that providers have in the United States today, because they're frankly not being set up for success to address a lot of health equity and cultural competence issues for different folks. And we've learned that no accrediting body requires health equity or cultural competence training. And so we created our own, and we focused on empirical issues that we know from a ton of research and that's been produced over the last 30 years, that for different populations lead to worse health outcomes for folks. And so we train, it's required, we call it the Spora Institute. All of our providers are required to complete this training before they can see any Spora patients. And so foundationally, we start at a population health level to educate our providers on things like maternal mortality, morbidity for our population, trauma-informed care, as an example, how primary trauma or exposure to understanding the trauma from different populations can show up in a clinical encounter, how that can change how an individual may interact with a provider or with the healthcare system. Verbal and nonverbal communication styles, what eye contact means for Black communities, and how that communicates trust, listening, making space for folks to ask questions, not dominating the conversation. These sorts of things are really important for different populations and different folks. But we also educate our providers to then take a more individualistic approach when they're interacting with folks, to understand and be curious about where there may be gaps in what we know from a sort of lit review perspective, down to when they're interacting with an individual, how that may vary, and to not make assumptions.
Wow. And that's incredible. And can any provider sign up for Spora Institute, or only folks that ultimately are on your platform, Dan? Because I could imagine, I'm just thinking through, I wish I could take this, as a provider.
Yeah. So today, only Spora providers can complete the Spora Institute. However, we are in the latter stages of being able to offer Spora Institute to providers for CME credits.
Awesome.
And we'll be making sure that other providers can get access to the Spora Institute as well.
Wow, super cool. Amazing, Dan. I know we're kind of running short on time. Can I ask you like one last question? I know the time has really flown by. So September is Prostate Cancer Awareness Month, as we all know. I know we're working on an article together between Buoy and Spora to discuss this. But for today's viewers, what should every Black man know about prostate cancer that you want to just spread the message on?
Yes. So I would say prostate cancer for Black men is something that needs to be talked about a bit more in the community. I mean, there are folks that are sharing their stories, at the risk of sharing sort of alarming statistics, but also making sure that we're being sort of very clear and straightforward about the reality today. For Black men in particular, they are more likely to be diagnosed by or for a prostate cancer, and are also more likely to die from the diagnosis than other populations. And also for Black men of over a third of the cancer diagnoses amongst Black men will be prostate cancer diagnoses. I believe 37% specifically. And so this is something that there needs to be more conversation from Black men with their primary care providers to focus on early detection. But it's also something that is still, from a research perspective, it's not as well researched and known why these sort of disparities are showing up for this population specifically. But what we do know today is that 1 in 6 Black men will be diagnosed with the disease at some point in their lives. And so early detection and conversation with your primary care provider is extremely critical so that we can stick around and continue to live joyful and fulfilled and healthy lives and show up for ourselves, show up for our families. Because these are things that, with early detection, there can be conversations around treatment. There can be conversations about how to approach, diagnoses or where folks are, sort of in their path. But it is something that we do need to create more awareness of, so that folks are having conversations and engaging with early stage providers, so we can get to a place where they're definitely increasing early detection for you folks.
Makes so much sense, Dan. Thanks for walking me through that, walking our audience through that. And I really appreciate you spending time with me today on our first episode. Really honored to have you as our first guest. Looking forward to continuing to build our partnership. And thanks for joining. Thanks to the audience for watching. First episode of Just Press Play. Thanks so much.
Thank you.